Every 40 seconds, someone has a heart attack in the United States of America. This equates to about 800,000 people having a heart attack. The craziest thing about this is that about 1 in 5 don't even know that they had it. This is known as a silent heart attack. This is why it's very important to understand the signs, symptoms of a heart attack so that you can potentially prevent a heart attack from a loved one or even worse, from yourself. Early recognition is key because time is muscle. The more time that you waste, the more time that you can lead to that irreversible damage to your heart. In this video, we're going to be talking about the 5 common findings that we see when someone is having a heart attack. So when it comes to a heart attack, the most common symptom that people complain about is chest pain or angina. What's concerning about the chest pain that you're having is that it's exertional. It gets worse with exertion or with stress. It gets better with rest or medication called nitroglycerin. The pain is typically here. And I've seen people describe it in so many different ways. They've described it as chest pain itself, chest heaviness, chest discomfort. So if you or a family member just doesn't feel right, ask them if they're having chest pain. And if they say no, keep asking and trying to get other questions, chest discomfort, or something in the chest that they cannot explain. The more that we can try to get this chest pain symptoms out of the patient, the quicker that they can get evaluated by their medical provider or even in the emergency department. So if you're having chest pain, chest discomfort, chest pressure, go and get seen as soon as possible. See a primary medical provider or even go to the emergency department. Because if you're having chest pain and you go to an urgent care, 9 times out of 10, they're gonna refer you to the ER. The second common finding that people complain about is shortness of breath. Medical term, dyspnea. Like the chest pain, the shortness of breath is worse with exertion and gets better with rest. Now this is because the heart is infarcting, the heart is not getting enough blood. Heart arteries not getting enough blood, which can lead to the shortness of breath. I do find that more commonly women will present with this, but also people who have had those silent heart attacks. So if you're having any type of shortness of breath, especially if it is new, you need to be seen as soon as possible by a medical professional or even going to an ER. With the pain, especially with the chest pain, some of the times I'll ask them, or most of the time I'll ask them, describe that pain for me and describe whether it moves around. Radiating chest pain is also some of the symptoms that they'll complain of. They'll say they've been having chest pain here and it's moved to the shoulder, chest pain here and it's moved to the back, chest pain here and it's moved to the jaw. The heart is here, there are nerves there, so you can have this. This is known as referred pain. Once again, if this is brand new, you definitely want to be seen as soon as possible. Some people will just have jaw pain or shoulder pain or back pain, and sometimes this gets labeled as atypical chest pain. In the past, that would lead to people not getting the diagnosis as quickly as they can. So we try to refrain from using the word atypical chest pain and call it probable chest pain so that we can continue that workup and evaluation to make sure that that discomfort that you're having is not due to a heart attack, because if it is, it needs to be opened up quickly. Fourth one is, I don't see it that often, but it's enough that we have to continue to be very cognizant and vigilant in asking appropriate questions, and that's cold sweats. A lot of times they'll say, hey man, not only am I having this chest pain or shortness of breath, I am just drenched from time to time. I'm cold, I am clammy whenever these episodes occur. It gets better with rest, but I just feel like I can't do anything. This kind of fits in that atypical presentation that we need to be very cognizant about and asking appropriate questions to make sure that we're not missing a potential silent heart attack. A lot of times people don't come to the hospital until their symptoms are at the extreme. Unfortunately, if you wait too long, we're not talking about restoring the heart back to how it was. We're talking about trying to save your life or trying to prevent multiple hospitalizations. And the fifth one, the one that just kind of ties it all up, is fatigue. Fatigue out of proportion. Specifically, you're telling me that you could have walked a block in the past without any issues. You used to go hiking on the weekends without issues, but now you're having difficulty with your normal activities of daily living. You walk to the mailbox and you're tired. You take a shower and you're tired. Once again, if all of this is new, it's really important for you to follow up with your medical provider. But if it's extremely concerning, please go to the emergency room as soon as possible. Once again, chest pain, heart attacks is the leading cause of death in the United States of America, and the biggest thing is early recognition. So if you know someone, even yourself or a loved one, that is having the symptoms, and if you're by yourself, call 911 if you can. Get seen by medical personnel as soon as possible. If you find any benefit in this video, let me know in the comments. Consider subscribing to the channel so that you can get more information about your heart, health, and most importantly, prevention.